trach care. Oh, remember, this is, we did need to have something across the chest, it was already there.
Yeah.
The only reason we do that is so that the patient, we don't get sputum everywhere, and we have to change their gown every time, you know, so it just keeps things cleaner, and we can take the towel off when we're done with trach care. Okay, so let's start with our clean gloves. We're going to come over and take off, well, we first got to introduce ourselves. We have to name and date of birth, because I left the room, so I got to come back and re-identify. Make sure I have my equipment. I want to reassess, listen to lungs, and that was the last thing I should have done with suctioning, is reassess, listen to lung sounds, make sure that my O2 sat had come up and that my the ventilator had flipped back to the original settings. Or if we have some kind of oxygen blow by, or nasal cannula, whatever, we turn it back to the original settings. In other words, we want their O2 saturation to be equal to or greater than what we started with. Okay, so if they started with a 93 and I'm leaving them at an 88, not a good plan. Okay, so we want to make sure they're back. I would keep giving them the supplemental oxygen until I at least got them back up to where they were. Okay. All right, now we're on to trach care. So I introduce myself, tell Mr. Spezio what we're going to do, name and date of birth, provide privacy, wash my hands, put on my clean gloves. Okay, so now I'm going to go ahead and take this dressing away from here with my clean gloves. I'm going to look at the drainage. When you have a new trach, this is going to be bloody. For an old trach, it's going to have, when I say old, one that they've had for a little while, it'll have sputum on it. So this will be a good opportunity for you to gauge the color of the sputum, and you can be telling the amount soon. A lot of times when they're ill, it's going to be more gold or darker tan in color. Could have a little bit of blood in it, but usually the older trachs. Have you seen trachs now at this point?
Mm-hmm.
Anybody? Yeah. So you know what I'm talking about? They're sputum machines. Okay, so we're going to throw that in the trash. Okay, so now I want to take my gloves off and I want to get my sterile field wooding. All right. Let's go ahead and I think I'm going to use this as my sterile space. I'm going to get me more room. Then I can use all my stuff here. So let's go over here. This is going to be my sterile space, so I should pick this up by the corners. And let's lay this down. Okay. Now I'm going to go ahead and slide my gloves out. I didn't look for the size of these, so this would be comical. And I'm going to dump the rest of it in here. Okay? So now before I have my, I'll stand in front of my fan. Now before I go ahead and put a mixture of hydrogen peroxide in one and saline, the other half of it, in one, and then I'm going to use this one over here as just saline. Okay? So I've got my liquids poured, and so now I want to put on my sterile gloves. I want to put hand sanitizer on, and then I want to put my gloves, sterile gloves on. These are probably mediums. I might venture to say they may not work, but you all enjoy watching me struggle. All right. Okay. One of these little flaps may have touched the other. I'm not sure. Did you guys see me break sterile technique? Surprising. All right, best I can do. Okay, so now what we're wanting to do, remember, we're going to take everything away. We're going to take everything away from them, and then we're going to change gloves again, and then we're going to put everything back in, right? Okay. So, I'm going to go over here to my sterile space. And I'm going to grab, we're going to clean. Well, no, first thing we got to do is take that inner cannula off. So let's get a 4x4. I guess any one of these will be fine. I can't get it to say. Okay, I'm going to break sterile technique. Do this. Okay. So now I'm going to contaminate this hand because I got to take the oxygen off. Okay. And then I'm going to take this 4x4 and I'm going to squeeze the inner cannula out. I'm going to Okay, this is my contaminated hand, so I'm gonna go ahead and tighten that back down. Drop this in the hydrogen chloride and peroxide, okay? Trash. Now I'm going to pick my sterile hand, and I'm gonna pick up some of these cotton tip applicators, and I'm going to wet them with the saline. Okay, I can hold these on the bottom, just don't touch the top. So now I'm gonna clean part of this and throw away. I'm gonna clean. I have to pull it out a little bit. Top and throw away. And I'm gonna use this last one for over here and throw away. Okay, so we've cleaned, so we've taken everything away. Now, we're going to don our second set of sterile gloves. Let's do it this way. Where'd it go? Okay, here's my second set of sterile gloves. Okay, so I'm trying to get them all separated. Okay, so now I'm going to wash my hands, and now I'm putting on my second set of sterile gloves. Or by wash my hands, I mean antiseptic, the antibacterial. Okay. Okay, now, these are a lot easier. Okay, so now we're going to clean and put everything back in. So I want to get my little brushy thing out here. Okay, and I want to clean. Okay, and we want to make sure it's clean on the outside. We're going to look for any crustaceans or anything that's on there. We're going to put it in the saline so that it's ready to go. And now we're going to pick up a 4x4 and we're going to dry it off. Okay, so now we're ready to put it back in. Both of my hands are still sterile. Okay, and then now we're going to put in the dressing. So we want to keep it as sterile as possible. It's a difficult thing. I'm going to go ahead and pull this side out and keep my finger on the faceplate. Okay, and I'm going to put this here, and I'm going to put it up underneath here. Okay, and at this point my hands are clean. It's the best we can do. I've contaminated them several times. And now I'm going to thread this back through here. Okay, now I'm going to walk around the bed, and I'm going to do the other side. Okay, the reason I do that is, where's my face if I do it on this side? My face is right over the hole, and I can get it in my face. So I walk around the bed, and then I'm going to reposition, put their oxygen back on. All right, and then suction them if they need it. A lot of times with that manipulation of the trach, it makes a lot of sputum come out, and so we'll go ahead and suction them again. I want to listen to them. I want to make sure that they're breathing okay. I want to change their gown if I need to. Put them in a comfortable position. This is probably dirty. It needs to go into the laundry bag. Put their head back down. And then also put the bed down if I put it up at all, okay? And then ask them if there's anything else I can do for them, and then we're finished, okay?